Most people who notice their vision getting worse do one thing. They book an appointment, read some letters off a chart, and walk out with a stronger prescription. That's the entire response to a progressive physiological problem, a stronger lens to compensate for a weaker eye. Nobody stops to ask whether the eye itself could be retrained. Nobody mentions that your eye is surrounded by muscles, real, trainable, atrophy-prone muscles, and that those muscles in most adults are operating at a fraction of their capacity. I'm Dr. Markus Dexter, and I'm going to tell you anyway. Here's what I want you to understand before we go further. Your eye is controlled by 6 external muscles on the outside of the eyeball, plus internal muscles that control focus and pupil size. That's a minimum of 8 muscles per eye, 16 for both eyes combined. 16 muscles that respond to training, deteriorate from disuse, and that most people never deliberately exercise a single day in their lives. Modern life demands near-constant close-distance focus. Screens, phones, books, and almost never demands the full range of eye movement. The muscles responsible for peripheral gaze, coordinated tracking, and rapid long-distance focus shifts spend most of their working lives nearly idle. Today I'm giving you a systematic, complete approach. 3 exercises targeting the external muscles, the internal focusing muscle, and the deep orbital tissue. No miracles, just physiology applied correctly. Drop a comment below. How old are you, and what vision change has bothered you most? I read every one. Let me give you just enough anatomy to make the exercises meaningful rather than arbitrary. Your 6 extraocular muscles move the eyeball in every direction. The medial rectus pulls the eye inward toward your nose. The lateral rectus pulls it outward. The superior and inferior rectus handle vertical movement with a slight rotational component. And the 2 oblique muscles handle torsional adjustments that keep your visual field stable when you tilt your head. All 6 fire in coordinated sequences every time you shift your gaze. Inside the eye, the ciliary muscle physically reshapes your lens. When it contracts, the lens rounds up for near focus. When it relaxes, the lens flattens for distance. That constant dynamic adjustment is called accommodation, and it's the function that deteriorates most noticeably with age. One important point before the exercises: anyone claiming that one single movement will dramatically improve your vision is misleading you. Your visual system demands 16 muscles working in precision coordination. One exercise targeting one movement plane cannot produce comprehensive improvement, any more than training one finger can make you a pianist. What produces results is a multiplanar, systematic approach. That's exactly what I'm giving you. The first exercise I call the wipers, and the name describes both the movement and the effect precisely. Here's the technique. Without moving your head, look as far as possible to the right. Maximum lateral gaze, the absolute edge of your range. Now, maintaining that extreme position, sweep your gaze slowly in a wide horizontal arc all the way from the far right to the far left, then back again. The movement should be slow and deliberate, not a quick flick, but a controlled, smooth sweep along the outer boundary of your peripheral vision. Maximum amplitude both directions. You should feel a distinct pulling or stretching sensation in the muscles on the side opposite to the direction you're moving toward. When patients do this for the first time, the most common reaction is discomfort, sometimes actual pain, at the far lateral position. I want to explain this clearly because people often assume it signals injury. It does not. It signals a lifestyle diagnosis. Think about how your eyes move during a typical day. Phone, computer, television, occasionally across the room. Research suggests that for most modern adults, the functional range used in daily activity represents roughly 10 to 15% of the full available arc of motion. Day after day, year after year, the muscles operating outside that narrow range receive almost no demand. Like any muscle subjected to chronic underuse, they shorten, stiffen, and lose elasticity. When you drive your eye to the far edge of its range, the muscle on the opposite side, the one that has to lengthen, pulls against that stiffness. That's what you feel. Now here's why the wipers have clinical significance beyond simple stretching. Chronically tight extraocular muscles exert mechanical pressure on the eyeball itself. The eye is not a completely rigid structure. It has walls, internal fluid dynamics, and it responds to external pressure. When surrounding muscles are in a state of chronic contraction, they compress the globe. That compression affects the microvasculature, the small blood vessels supplying the retina. The retina is neural tissue, an extension of your brain located inside your eye. Neural tissue is among the most metabolically demanding in the human body and is exquisitely sensitive to reductions in blood supply. When retinal perfusion is compromised, even modestly, visual acuity declines. So when you perform the wipers with maximum amplitude, you are not just loosening tight muscles. You are actively reducing mechanical compression on the eyeball, restoring vascular flow to the retina, and improving the oxygen supply to the tissue responsible for your vision. Timeline. In the first week, discomfort at the extremes of gaze decreases noticeably. By the end of 2 to 3 weeks, it is largely gone. The disappearance of that discomfort is a reliable indicator that the extraocular muscles have regained a healthy, functional resting tone. Maintaining it requires only a few minutes of daily practice. The second exercise is vibrational massage of the eyeball. Let me explain the physiological rationale before the technique, because the rationale is what makes this more than something arbitrary. In manual therapy, vibration is uniquely capable of transmitting mechanical energy deep into tissue. It travels as a propagating wave, not just affecting the surface layer, but moving through the full thickness of whatever structure it contacts, including layers that cannot be reached by surface pressure alone. Apply that to the eye. Inside it, you have the vitreous humor, a gel-like substance filling most of the interior. 3 concentric wall layers, the sclera on the outside, the choroid in the middle, densely vascular, full of blood vessels supplying the eye, and the retina on the inside. All of these structures are surrounded by the extraocular muscles and orbital connective tissue. To produce a beneficial effect on all of these structures simultaneously, improving circulation through the choroid, relieving tension in the orbital tissue, normalizing fluid dynamics, surface pressure is not the right tool. Direct forceful pressure on the eye is in fact contraindicated. It can transiently elevate intraocular pressure, which in susceptible individuals can be dangerous. Gentle vibration, however, is physiologically appropriate. It stimulates microcirculation, promotes tissue fluid exchange, and gently mobilizes the surrounding connective tissue without generating harmful pressure spikes. Here is the precise technique. Place one finger at the inner corner of your eye, the medial canthus, the point where the upper and lower eyelids meet near your nose. There is solid bony support there from the nasal bone immediately underneath. Place a second finger at the outer corner of the eye, the lateral canthus, where you have the lateral orbital rim, also solid bone, as your support. This is critical. Both fingers should rest primarily on the bony orbital margin, not on soft tissue. This prevents inadvertent lateral pressure on the globe itself. Now, with the soft pad of your fingertips, make the lightest possible contact with your closed eyelid. Not a press, a touch, the weight of the fingers barely landing. From that position, initiate a fine, rapid vibration, small amplitude, fast frequency. Continue for 20 to 40 seconds without increasing pressure. Then slowly lift your fingers away, pause 5 seconds, and open your eyes. The majority of people immediately perceive an improvement in clarity. Colors may appear slightly more vivid, detail may sharpen. This is not placebo. It is improved microcirculation in the choroidal vessels, relaxation of the orbital musculature, and normalization of fluid dynamics within the ocular tissues, all occurring in under a minute. The third exercise targets the ciliary muscle, the internal focusing muscle, directly. This is the exercise most relevant to presbyopia, the clinical term for age-related near vision loss. Presbyopia is what happens when, typically in the early to mid-40s, people begin holding reading material farther and farther from their face to bring it into focus. It affects virtually everyone in Western populations who lives long enough, and it's almost universally managed with reading glasses or progressive lenses. The standard explanation: the lens hardens with age and loses flexibility. This is partially true, but here's the part that rarely gets mentioned. Research has demonstrated that even in presbyopic patients, the ciliary muscle continues to contract in response to accommodative effort. It is the lens that fails to respond, not the muscle that fails to fire. This means the ciliary muscle can still be trained, still be maintained, and may play a role in slowing functional decline when exercised consistently. The standard recommendation is the near-far focus shift. Hold your finger close until it blurs, then pull it back to clarity. This works, but it loads the ciliary muscle in only one plane. Here is a significantly more effective version. Bring your finger toward your face until the image begins to soften, approaching the near point of your accommodation. Hold it at that distance. Now, rather than simply moving it straight toward and away from you, begin moving it in a slow circle, upward to one side, downward to the opposite side, while maintaining the clearest focus you can manage. The ciliary muscle must now work not only to maintain near focus, but to adapt that focus dynamically as the target shifts in space, changing its position relative to your eye's optical axis and the extraocular muscles holding gaze on target. Then reverse the direction of the circle. Then begin incorporating distance changes during the circular motion, gradually bringing the finger closer through one part of the arc, drawing it back out through another. What you are producing is a multiplanar, dynamically varying load on the ciliary muscle, a training stimulus categorically more complex and effective than simple linear movement. The practical challenge with any eye exercise program is not learning the technique, it is maintaining the habit. The solution is anchor linking, attaching the new habit to an existing, already automatic daily behavior. Do your ciliary exercise during your morning coffee, during the 30 seconds your computer boots, at a red light. The anchor doesn't matter as long as it is genuinely daily and genuinely reliable, because 3 minutes of these exercises done consistently every day for 6 months dwarfs the benefit of a 45-minute session done once a week. Consistency is the entire game. Exercise is a biological stimulus. The response to that stimulus, tissue adaptation, improved function, depends entirely on the quality of raw materials your body has available. The single most important nutritional factor for retinal health, and the most commonly deficient in older adults, is vitamin D. Vitamin D plays a direct role in the function of photoreceptors, the specialized cells in your retina that detect light. Its relationship to age-related macular degeneration, the leading cause of irreversible central vision loss in adults over 50, is well established in epidemiological research. If you are doing eye exercises but your vitamin D level is deficient, you are working against yourself. Get your level tested. Correct it if needed. Supplementation is inexpensive and safe within appropriate dosing ranges. Now, there is an angle on eye health that almost never appears in clinical guidelines, but that I have observed repeatedly enough to take seriously. Traditional medicine systems map the liver as the organ most connected to visual function. Dismiss that as ancient metaphor if you like, but consider this. When hepatic function deteriorates to the point of jaundice, one of the first and most visible signs is yellowing of the sclera, the white of the eye. That finding, scleral icterus, is taught in every medical school in the world. The ancient observation encodes a real anatomical relationship. The practical implication, if your vision is declining, it is worth examining what you are doing to your liver, because the liver's functional state has a meaningful impact on the metabolic environment in which your eyes maintain themselves. 2 dietary categories damage the liver most directly. First, fried and smoked foods. Cooking at high temperatures generates polycyclic aromatic hydrocarbons and oxidized lipid products, both hepatotoxic, meaning directly damaging to liver cells. The more consistently your diet loads the liver with these substances, the more its functional capacity for everything else is consumed. Second, processed meats. The nitrites, synthetic colorants, and preservatives they contain serve industrial purposes only. None of them nutritional. All of them must be processed by the liver. The less adulterated your food before it enters your body, the less chemical burden you place on the organ doing the largest share of your body's detoxification work. For direct liver support, milk thistle has among the strongest evidence bases of any botanical agent in hepatology. Its active compound, silymarin, stabilizes hepatocyte cell membranes, making them more resistant to toxic injury, stimulates cellular regeneration after damage, and functions as a potent antioxidant. These mechanisms are pharmacologically documented. If you are serious about supporting the metabolic environment in which your eyes function, the liver is a legitimate target and milk thistle is a legitimate, evidence-supported tool. Here is your complete protocol. A combined investment of 3 to 5 minutes per day. The wipers, full amplitude horizontal sweeps along the outer edge of your visual field. Targets the extraocular muscles, releases chronic tension, and restores blood flow to the retina by reducing mechanical compression on the globe. Vibrational massage, gentle, bone-supported fingertip vibration on closed eyelids for 20 to 40 seconds. Targets deep orbital tissue, choroidal circulation, and overall ocular fluid dynamics. Circular accommodation training. Multiplanar, distance-varying ciliary muscle loading using your finger as a near-visual target. A substantially more effective stimulus than standard linear near-far exercises. Attach each exercise to an existing daily anchor. Commit to it the way you commit to brushing your teeth, not because it feels urgent today, but because the compounding benefit over months and years is what produces the outcome you actually want. Alongside the exercises, reduce fried, smoked, and heavily processed food from your regular diet. Consider milk thistle for liver support. Test your vitamin D level and correct a deficiency if one exists. You are not helpless in front of your own biology. Your eyes are trainable, your supporting physiology is improvable, and the information to do it is available to you right now, at no cost, without a waiting room. Tell me in the comments, how old are you and which of these 3 exercises are you starting with? I read every word. If this gave you something valuable, share it with someone whose vision has been quietly declining. They are probably reaching for stronger glasses without ever being told there was another option. Subscribe for honest, research-grounded health information every week, designed specifically for adults who want to live stronger and sharper on their own terms. I'm Dr. Markus Dexter. Your eyes have been working for you every waking moment of your life. Give them 3 minutes tomorrow morning. It is more than a fair trade. This video contains general health information based on published research and clinical experience. It is not a substitute for personal medical care. If you have an eye condition or are under the care of an ophthalmologist, please consult your physician before beginning any new eye exercise program.